All right. Well, why don't we go ahead and finish up. We're going to move on to the last application that we're going to demonstrate tonight, and this is the LimeLight treatment. It's going to be on the same patient that we've seen earlier this evening, and if we can switch to Barb's room, we're going to see the LimeLight device. This is a pulse light device, and we're going to be here setting the parameters on the device so that we're targeting both reds and browns, because this is the patient's concern here, obviously.
And this is the interesting thing about the LimeLight, isn't it, Rick, is that this particular device is very effective for red and brown, and I think also for texture. And but it gives a lot more juice, and it has that capability. And so it's sometimes a little bit more uncomfortable. And so we'll often give people a little analgesia orally. You know, maybe we'll give them, you know, a couple Tylenol extra strength or so. We don't use topical anesthetics on this, such as amla, because you find they sometimes contract down the vessels, and then there's nothing to suck the light in.
You don't have your target.
That's right. We've lost our target, our chromophore. But in many cases of this, you will have to decide, are you going for red? And then you go from the programmable A series. Is it red and brown you're going for? Then you'll use the B series. If it's a darker complexion person or they've just got brown, you might think of the C series. In many cases, and I think this lady is an example of that, she has both red and brown, but mostly red. And I would tend to use in her something like the B series, and perhaps, you know, something like 18 joules per centimeter squared. But there's two ways, I think, to do this, isn't there, Rick? And we talked about that we do this a little bit differently. One way is to do test sites of, you know, perhaps 3 or 4 applications, and take photographs beforehand and see which works best after a period of, say, 2 weeks. Because sometimes if they got a lot of brownness, I find that the area will pick up those brown spots very well, and they'll get very dark and peel off. And the other one, and certainly we use that technique as well, is that you shoot at it, and you might use, again, a few different parameters. You might do 14, 16, 18, 20, depending on the color of the skin, whether they have any tan or not. Of course, if they're tan, they're going to pick up more, aren't they? And do the test sites, wait 20 minutes, and look at it. And you want some background erythema at the target site, but you want the brown spots to sort of light up a little bit. But you don't want more than that, because you don't want to overheat the tissue. So by doing that technique, you can do it the same day. Sometimes I like to see the actual results. So if the patients are in a rush, I'll get them to come back. And so this is, I think, a very good technique. We had a woman who we did her face, neck, and chest, and she had seen a bit more sun than I anticipated, and she picked up really well with this, and she got a fair reaction, actually. More than I anticipated to give her. And but the results were absolutely sensational. But you prefer that not to be a surprise to you, but a calculated plan.
Well, no question that you don't want patients tanning prior to use of a shorter wavelength device. And this really goes back to the laser physics, doesn't it? I mean, we've got a procedure here that we're doing that you really have to be careful about your patient selection. But when you are, you have absolutely fantastic results with this particular device. But this is not for every skin type. Here in the Northwest, where we have mainly lighter colored skin types, it works out very well for us. But in a population where you have, you know, let's say a Hispanic or African American population, it's really, you have to be exceedingly careful with a shorter wavelength device.
You know what I've been quite pleased with almost all of these devices, people who have had a lot of experience have devised outlines as to what you might or might not use. For example, if the person is tanned, if they're type 2 skin or type 4 skin, if they have had recent sun exposure or whether it's old sun exposure. And it's very simple, actually, usually to follow those little outlines. And they tend to be a bit on the conservative side, which I think is wise. But I'm always pleased that those things are available to us when we first start using these machines. That, and I think elbow-to-elbow observation and training is really valuable for these techniques.
No question about that. Now, I think Barb is getting close to the end of this side. I wanted to comment that, although we won't be able to show it, when we do these sorts of applications, the spider vein treatment, the laser genesis, or the LimeLight, in this case, we will always apply sunscreen. Even here in Vancouver, Washington, we always apply sunscreen to patients before they walk out the
It's
door.
called delusion.
That's right. Well, it works for us. So,
Well, the other thing I think that, Rick, that when you said you always apply, I thought you were going to say we always make sure that with the LimeLight and with these various devices, the Titan thing, is that we have full body exposure of the tip on the skin, because you don't want it partly off, because you can get some heat damage in this case, can't you?
that's absolutely correct, because this actually is heating and cooling, as with the other applications that we've seen earlier. And you can see here, well shown, that sapphire window is being directly applied to the skin, and you can even see Barb pushing up the skin a little bit so that the entire treatment surface is applied to the skin, so you don't get that radiant heat, because that really, it can be uncomfortable if that's not done properly.
This photography is so impressive too, isn't it? I mean, we can see exactly what's happening here. I guess the other thing that you've alluded to, and I think is worth re-emphasizing, is in many cases it's nice to use a little gel. Maybe just a little bit of gel. We don't use the gel at all with Genesis, for example, but I think with the LimeLight and with the Titan, I find it really helpful because you can see where you've been. Because if you were to cover a large area, for example, if you're going to use LimeLight to the chest, it's easy to miss areas because you don't want to overlap too much and get heat damage.
Oh, absolutely.
You know.
Well, while Barb finishes up this treatment, why don't we go ahead, Don, and we'll comment on some before and after photographs with LimeLight. And I think we'll go ahead and move to these pictures here in just a second, and we can comment on those. Now, we have before and after that will be brought up on the screen very rapidly here. And why don't you go ahead and comment on this slide?
Well, here's a case where you'd have to make a decision as to whether this is melasma or lentigos. And I think it's largely lentigos from what we can see on it. But melasma can give that brown coloration that comes with sun and ultraviolet light. And melasma usually responds very nicely to a combination synergistic cream where you have glycolic acid and kojic acid and tretinoin and hydroquinone, and you put these all things together, and that with sunscreen works very well. But in a case, and I mention that because usually it's the only thing that really works for melasma, whereas with areas of lenticels such as this, and with some texture changes and maybe a little erythema, your best bet is probably with a LimeLight because it goes for red and brown, and it, as you can see, it really clean things up nicely. Notice it's 2 weeks after the first treatment, Rick, and I think often when you get these pigmented spots light up, it takes a couple weeks on the face for it to turn over.